Hello, it's a pleasure to welcome you all to today's session on engaging the private sector to improve local health service delivery in a pandemic. I'm Jeff Sturchio, the chairman of Rabin Martin. This session is part of a series developed by CCA's Health Security and Resilience Initiative, which is an initiative that has three pillars devoted to disease management and service delivery, to universal health coverage, and to trade and investment opportunities for health in Africa. Through this initiative, CCA is exploring how the private sector can help African governments and societies to advance their healthcare systems, particularly the public health supply chain, to better meet patient needs and improve the availability of medicines, diagnostics, and vaccines to those who need them. The COVID-19 pandemic exposed significant weaknesses in the ability of countries around the world to identify and obtain supplies and services they suddenly needed urgently. This was particularly true in Africa. As Ahmed Ouma, the deputy director of the African CDC, observed recently, one of the lessons of COVID-19 was that, quote, when the chips are down, Africa is on its own, unquote. And over the past several months, there have been remarkable innovations and leadership from Africa. The African Medicine Supply Platform has brought companies and governments together to really ensure that supplies are available where they're needed. The African Union has set up the COVID-19 Africa Vaccine Acquisition Task Team. And of course, African countries have been collaborating with COVAX to obtain more supplies of necessary vaccines. Nevertheless, supply chain challenges related to African vaccine distribution and service delivery remain as countries look to increase COVID-19 vaccinations and healthcare coverage for their populations, including expanding the portfolio and volume of products for other diseases. So this panel discussion will explore the range of actors, processes, and information needed to deliver health products to African people throughout the complex healthcare marketplace and explore opportunities to leverage private sector skills to address the current health sector supply chain bottlenecks. It's my pleasure now to introduce your moderator, Temitope Iluyemi, who's Senior Director of Global Government Relations for Procter & Gamble in Africa. She has been at Procter & Gamble for more than 20 years, and she's lived and worked from Nigeria, South Africa, Ghana, Togo, and the United States in addressing the issues that Procter & Gamble's business deals with. She's a qualified pharmacist, and with that background, I think that her perspectives make her the perfect moderator for today's discussion. So Tope, over to you.
Thank you very much, Jeffrey, and good morning, good afternoon to all our guests online, as well as our panelists and everyone else. It is really a pleasure to be moderating this very important topic at this particular time. I think it's quite opportune that we have this topic up at this time. We all expected that the pandemic would be behind us after the horrors we went through in 2020. But it looks like we need to fashion out the perfect way to weather the storm while it lasts, and at the same time ensure that we have the right supply chain systems in place to ensure that goods and services, and particularly healthcare products, can get to the end consumer in the right manner. Now, to do justice to this topic with me today, which is about engaging the private sector to improve local health service delivery during the pandemic, I welcome on stage my esteemed group of panelists, who include Ms. Azuka Okeke, the CEO of the Africa Resource Center for Excellence in Supply Chain Management, Ms. Julia Spencer, Associate Vice President for Global Vaccine Policy at Merck & Co., Patricia Obozua, Vice President, Public Affairs, Communications and Sustainability at Coca-Cola, and Dr. Muyiwa Tegbe, Deputy Director for Primary Healthcare at PATH. I will proceed, given the background that Jeffrey has shared with all of us, to speak to our esteemed panelists and ask about their organization's experiences in navigating the supply chain bottlenecks across Africa, particularly during the current pandemic. My name is Tope Iluyemi, and I'm the Senior Director for Government Relations for Africa at Procter & Gamble. Now, we'll share a little bit about P&G's experiences during this period. Now, as COVID-19 continues to be a challenge in many parts of the world, P&G has remained focused on our three immediate priorities. One is protecting our people, serving our consumers, and supporting our communities, so that we can all continue to step up and step forward as a force for good and as a force for growth in this time of need. We're playing our part to get others vaccinated. And in Africa in particular, we're providing a supply chain expertise through the Gates Foundation in the Vaccines Resource Center. And we recently completed a supply chain training with representatives of the Ministries of Health of Togo, Senegal, and Cote d'Ivoire in partnership with the ARC. Now at P&G, we also made sure that essential hygiene products were made available following the highest safety and health standards and advice from governments as well as medical authorities. COVID-19 has shown why we need to develop alternate supply chain networks within the continent. Beyond the COVID, African countries becomes very clear that we need to develop trading capacity with each other, starting with the implementation of the Africa Continental Free Trade Area, the AfCFTA, and also institute policies and processes to ensure that we can reduce the cost of raw materials as well as essential products. As a company, we also support vaccine efforts on the continent through a $5 million donation to COVAX, a fund established and co-led by Gavi, the Global Vaccine Alliance, to help ensure equitable access to vaccines in more than 90 countries throughout Asia, Africa, Latin America, and Europe. Our contribution will provide 1 million vaccines around the world, including Africa. With that background, I'm going to now move over to my esteemed panelists to share some of the lessons and opportunities and recommendations that they have experienced, including using case studies from their companies on their experiences around the challenges on the supply chain during this pandemic. I will start with Ms. Azuka Okeke, the CEO of Africa Resource Center. She will introduce herself fully and then share with us case studies from the ARC. Azuka, please.
Thank you very much, Temitope, and it's an honor to be one of the panelists. And of course, I always get excited when we're talking about supply chains in Africa. I work as the CEO for Africa Resource Center for Excellence in Supply Chain Management, and we have been in existence since 2016. Coincidentally, we conducted a feasibility study with MIT Boston, the Center for Transport and Logistics. We did that in 2018 because we wanted to actually understand the state of supply chains in Africa. We recognize the notch cut-edge research that the MIT CTL scale is known for. And of course, we realize that all over the continent, in every continent except Africa, there was a center for a scale center, what they call Center for Supply Chain Excellence across those countries because of the relevance of supply chain management in expanding the economy. And so we actually engaged MIT to understand where Nigeria and also Africa at large, where they were in supply chain management. We were looking at it from the angle of how do we diversify the economy? Even though Africa, ARC, ESM as we call ARC, has been funded by Bill and Melinda Gates Foundation to look at health, public health, we realized that supply chain is a critical enabler and has multiplier effect. So when we had that feasibility study, it was as if we were preparing for the pandemic because we were able to see the opportunities and also look at the challenges in the system, primarily in Nigeria, and to begin to prepare the country to see how we leverage, particularly, how do we look at the issue of supply chain professionals, the access to research to inform policy changes, the collaboration that is required between public and private sector to look at infrastructural development. And also, we realize that without innovation, the platforms for shared learning, disseminating the right information, we will not have visibility as to how relevant supply chain management is in the system. So we were quite strategic in our approach. And what we recognized was we were very naive, I would say, as an organization. We felt, well, we have very advanced private sector in Nigeria, even in other African countries, but that Nigeria would definitely have those companies with global footprints, with supply chain expertise that the government could leverage. So maybe we don't necessarily need to have a center for academia or for academic and education and research in the country. If we have those companies with those expertise, all we then need to do is to facilitate expertise transfer. So what we found out coincidentally was that even companies like Dangote, some of the top oil and gas companies, they didn't have supply chain expertise in-house. I recall having a meeting with Dangote, the global company, or I would say the framework company, or the company that controls both the cement and sugar. And when we were talking about where they get their talent, how they source talent, and if government could leverage the talent, they said, well, we don't have talent, and if you have, show us, because we need to access supply chain talent. So at that point, we recognize that as a country, there is need for expanded access to supply chain talent. We need to institutionalize supply chain education in the continent. We need to have universities that provide supply chain postgraduate degrees. We need the country to readily access, if companies want to access both professionals, we need to look at that. So we still collaborated with MIT. Primarily now we're working with the MIT Skills Center in Spain to see how people can start off the MIT MicroMasters and then go to Spain to complete their master's degree. Till date, we have many people in government, particularly in the public health sector, that are advancing in that area. And we're happy to see innovations really come up in states like Yobe. You wouldn't imagine that, because Yobe really had an issue with internally displaced persons during the Boko Haram insurgency. So they needed innovation. So with the right people in government, they have been, accessing people in government that are helping them test models. They are actually trying to collaborate with a company that is into drones. So this is just one of the states, but we're seeing innovative PPPs between states like Kaduna, Kano, and Niger State, with pharma companies for expanded access to medicines. So for me is that we do have a country right now, particularly in the public health sector, that is a bit aware of the relevance of supply chain management and how that can actually expand not just health sector, but have a multiplier effect to affect the economy. So we are happy to see some of that into place, and yes, some of the learnings we have. Thank you very much.
Thank you very much, Azuko. I have to say that's quite an excellent intervention in the supply chain space. And having worked in the supply chain operations myself, I do realize the challenges and the need for this type of education, not just to have the professionals, but also to educate the businesses on what the outages are. So a very big thank you for that intervention. And I hope that the program that you have with MIT is actually also being designed with a localized curriculum in mind. Okay, thank you very much. I'm going to move over to Julia Spencer, our Vice President of Global Vaccine Policy at Merck & Co., to talk to us about the case study of the work that MSD has taken up with UNICEF to establish the world's first Ebola vaccine stockpile, and what are the lessons that have been learned from that. Julia.
Thank you so much. And I'd like to start by thanking the Corporate Council of Africa for bringing us together today. I have the honor of leading MSD's global vaccine-focused public policy and partnership efforts. We're a global innovative pharmaceutical company with more than a century of experience in developing, manufacturing, and delivering vaccines against some of the world's biggest health threats. And I was really excited to hear the excitement in my fellow panelists talking about supply chains, because compared with the excitement about R&D to create new vaccines, the topic of supply chains is not very scintillating, but it is so important for every one of us who needs to be protected against vaccine preventable diseases. For many policymakers, and even for maybe many people in the audience, this can be an overlooked aspect of an effective immunization system. And when the supply chain is working, no one really notices. But when it's not, problems can grind progress to a halt, as we've seen in this pandemic. But even before the pandemic, weak supply chains resulted in wasted doses, stockouts, inequitable access. And the pandemic has demanded even more of vaccine supply chains. And in many cases, they haven't been able to deliver, either because of lack of ultra cold chain capacity and inability to distribute vaccines with a shorter shelf life, or the lack of vaccination sites in hard to reach areas. And just an example of the situation pre-COVID, there was a study done of 57 Gavi countries that revealed that across 134,000 vaccination sites, only 2% had optimal equipment. And the challenges we're seeing across the spectrum, from no equipment at all to the best as poorly performing equipment. And this was well before the need for ultra cold chain equipment. And the result of this is missed opportunities to vaccinate and people and communities left unprotected. So in addition to the work that we've been doing for our Ebola vaccine, more broadly to address these supply chain challenges in Gavi eligible countries, we have a long-standing partnership with the International Federation of Pharmaceutical Wholesalers Foundation to support Gavi's supply chain initiatives. And I'm happy to speak about that in more detail during the session. But I think what this shows is that this type of technical cooperation is critically important. And it illustrates that the expertise that the private sector, and in particular vaccine manufacturers, have can really bring a lot of contributions to health system strengthening partnerships. But I wouldn't be a public policy professional if I didn't also discuss the importance of regulatory capabilities and that capacity as an important part of the supply chain story, and as a key facilitator or a barrier to supply chain innovation, because there are a lot of interdependencies between supply chains and regulatory processes and requirements, and they influence both market access at a country level, as well as physical access to vaccines in communities. And these regulatory policies need to encourage and enable incremental vaccine innovation that makes supply chains simpler and more efficient. An example I'll talk about in a second about Ebola. This kind of regulatory streamlining and harmonization enables labeling and packaging innovation, which in turn enables manufacturers to more easily ship vaccines from one country to another, or to reduce package size and the associated cold chain footprint. And I know my fellow panelists know this well. This sounds easy, but it actually takes a lot of ongoing collaboration to both identify and to solve these supply chain challenges. And a great example of this is the work that we did with multi-sectoral partners to enable the use of Ervebo, our licensed Ebola vaccine, which has been used in the outbreak responses across the African continent over the last couple of years. And I think that we have a window right now, because of the attention on vaccine supply chains, to use the kinds of experiences we had with Ebola to call for greater investment in supply chain strengthening and regulatory strengthening to support optimization of vaccines access. And as we look forward, and as new innovative vaccines across the life course are expected to come to market over the next 5 to 10 years, these supply chains will not only have to be more robust, but they will have to expand to literally make space for more vaccines and to reach new cohorts of people, such as the adults or the elderly, and in new places. And this means more investment is required. This is not a super exciting topic for most people, but we need to find a compelling way to communicate why this is smart spending outside of the people that are supply chain experts. And to really illustrate this point in my opening remarks, I'll close by telling you about the result of one published paper that estimated vaccine wastage accounts for about 8% of the total cost of immunization programs in low and middle income countries. And when you consider this in terms of missed vaccinations and people unprotected, it becomes easier to see the real impact of investments in supply chains to ensure that every dollar invested is going toward efficient delivery of vaccination services. And I'm happy to talk more about both our Gavi work as well as our work on Ebola during the Q&A part of the discussion.
Thank you very much, Julia. It's actually quite gratifying to see the extent and the depth of work that MSD has put into this. So not just about the R&D aspect, but also combining that with supply chain readiness, innovation, and also already planning for the future. And I'm sure that a lot of the lessons that you learned, in stockpiling the available vaccines will definitely help in the planning that you do now in the current pandemic that we have. So I'll come back to you in another round to ask a few more questions. You've given us a lot of statistics here, and I'm interested in how we can actually operationalize some of this in the cost section, but I'll come back to you. Now I'm going to move over very swiftly to Patricia Obozua of Coca-Cola. And Patricia, can you share more about the can you share with us the work that Coca-Cola has been doing in ensuring that you can leverage your lessons and knowledge in the supply chain in promoting the distribution of vaccines across the continent? Patricia.
So thanks, Tope, and thank you to the CCA for putting this program together. I'm honored to be part of this panel. I'm Patricia Obozua, Vice President for Public Affairs, Communications, and Sustainability for Coca-Cola across Africa. Now, most people know our company, Coca-Cola, just by virtue of the drink Coca-Cola. And our mission is to refresh the world and make a difference. So while we provide a very well-loved brands, we want to do our business sustainably, and we are working to create a better shared future for people and the communities in which we operate. So that's what guides the work that we are doing with Project Last Mile, which is the focus, which I'm going to focus on for our conversation today. So the origin of Project Last Mile, well, first of all, Project Last Mile is a collaboration with the Coca-Cola Company, the Coca-Cola Foundation, USAID, PEPFAR, the Global Fund, and the Bill and Melinda Gates Foundation. And it is focused on drawing private sector lessons across the Coca-Cola system supply chain to help improve accessibility to life-saving medical health services and medicines across Africa. Now, the origin of Project Last Mile was really from the Global Fund and the Bill and Melinda Gates Foundation, who had made huge investments in healthcare in Africa and wanted to protect those investments. So they approached us, and that is how it was all formed. So what we focused on doing is using our expertise across the Coca-Cola system's supply chain. And when I say the Coca-Cola system, I mean the company and our network of bottling partners. So we've used expertise and experience from across the Coca-Cola system to develop, strengthen ministries of health, their capabilities in supply chain management, in creating awareness around health programs, and in actually providing services like cold chain equipment, for example, in Africa. Now, some of you might have heard, some might not, But earlier in the year, I think it was in May, as part of the activities for Coca-Cola's 135th anniversary, we announced an investment by the Coca-Cola Foundation in a fund called Stop the Spread for COVID-19. So there's a $20 million investment globally in the Stop the Spread Fund, and 10% of that, 2 million, was already allocated to Africa to Project Last Mile, to work with nonprofit organizations to deliver programs focused on vaccine distribution, personal protective equipment, and raising awareness around COVID vaccine. And since then, Project Last Mile has started working on programs across 8 countries in Nigeria, Ghana, Liberia, Sierra Leone, Mozambique, Tanzania, South Africa, and Eswatini, looking at programs across those countries. But even, I can give you 3 examples, for instance, of projects that have already started. In South Africa, one example is Project Last Mile has worked with our bottling partners, CCBA and Peninsula Beverages, to set up 9 vaccine stations in 3 provinces in South Africa. So it's a project that's going to cover 9, but I think we're about to set up the first one in Cape Town. In Eswatini, another example is we helped run a cold chain audit to repair non-functioning cold chain equipment. We did this in partnership with one of our vendors called Liquid Logic. And within the first month, Liquid Logic has assessed equipment in 95% of the country's health facilities to increase and expand the Ministry of Health storage capacity for the COVID vaccine. Another example in Tanzania, Project Last Mile is supporting the Christian Social Services Commission for vaccine rollout to 150 vaccination centers in collaboration with USAID. So it's a massive program, but because we already had Project Last Mile's experience since 2010, 11 years experience in working with our partners to deliver programs around HIV/AIDS, creating awareness, providing health services. It was quite easy to transfer that when the pandemic hit, to developing those health systems, to supporting strengthening capacities with the ministries of health, and to continue to grow that program across Africa.
Thank you very much, Patricia. I was having some trouble unmuting myself. Project Last Mile, I think it's such an apt name for a company like Coca-Cola, who has very, very strong supply chain systems across Africa, with the much loved drink, Coca-Cola. What's also very interesting about all the examples that you've shared is the recurrent theme of preparedness, before the pandemic hit, and how many of the countries that are companies that are speaking today have actually then fallen back on some of these systems and expertise that they have in place and applied that to resolving issues around the supply chain during the pandemic. Another thing that I'm picking up, we've had 3 speakers now, is the theme of collaboration and partnerships to make this work. Ranging from partnerships in academia to technical assistance, to collaborations with other experts in the supply chain to ensure that you can get these vaccines and other health products to the final consumer in the last, covering that last mile. I think it's quite ingenious, and how we're all inadvertently being kind of prepared despite the shock of having the pandemic hit us at the time it did as well. So thank you very much for sharing that experience with Project Last Mile. I'm going to move now to Dr. Muyiwa Tegbe, who is the Deputy Director for Primary Healthcare at PATH, to talk to us about the PATH primary, the case study that PATH has engaged in through various primary healthcare centers, and the data collection and approach that ensures that everybody has a fair access to healthcare and well-being, and particularly focusing on the 4 principles of scaling health products. Dr. Tegbe.
Thank you so much. It's a pleasure to be here, and I just want to thank CCA for putting this together, and it's a pleasure to be part of this conversation. A little bit about PATH. PATH is an organization that has been around for over 40 years, and we have a presence in over 70 countries, doing a lot of work, ranging from product innovation to actual implementation, scaling up of product delivery and adoption. We also have a lot of expertise. PATH is well known for actually the innovation part of work. And this conversation is really important to PATH because recently we started refocusing our efforts to actually working in primary healthcare, not just working in primary healthcare, but prioritizing primary healthcare, because if a supply chain is faulty, your primary healthcare system basically is broken as well. So we have in the recent times actually trying to harness our internal efforts and our internal expertise towards shoring up primary healthcare systems. And one of the things, and some of the things that we have done over time has given us the expertise or the experience to be able to say, okay, this is the next way forward with primary healthcare and strengthening primary healthcare systems, making healthcare equitable or providing access, equitable access to healthcare for a lot of people, and also ensuring availability, as it were. So over the years, we have learned a lot of, we have gotten a lot of experience, and I'm going to speak to some of what we have learned around regulatory barriers and entry and things that need to be considered when you're introducing products. But just piggybacking, just going back to what we learned, some of the things that we learned during COVID, particularly focusing on Africa. A couple of things stood out to us based on working with our country teams and working with our experts on ground. Africa had very insufficient COVID testing capacity. As we know, just about 54 million tests had been done by the end of last year. And that's looking at a country of 1.3, like a continent of 1.3 billion people. We are very well aware of the current vaccine statistics. Just recent, based on our data, we know that just about 2% to 2 to 3% of Africans have received at least one dose of vaccine, of the COVID vaccine currently. And also, in addition to that, while a lot of countries, a lot of continents were struggling with oxygen supply, Africa was particularly very hit. One, because that capacity did not exist previously in a lot of countries. So a lot of our experts had to double down on trying to ensure that how do we ensure that countries actually have have capacity or have oxygen available to them. Then the biggest part of it that we found out was that Africa had very, very limited manufacturing capacity. That is why the pandemic was basically exacerbated in Africa as well. So let me dial back to actually talking about some of the things that we have learned over time, and I can talk some more about this even as the conversation goes on. One of the principles that we've learned around regulatory, about making drug introductions or product introduction very, very feasible is, one, we need to make those options affordable. Particularly in low middle income countries, we cannot be bringing in, we have seen that bringing in expensive products or devices that are beyond the reach of people or beyond the reach of 80% of the population basically doesn't make sense. Secondly, is also having evidence of impact. A lot of countries basically need to understand that this, either a vaccine or a product, basically is going to support the health, improve health outcomes in those countries. And it also makes a lot of sense when you're having conversations with partners at the Ministry of Health and things like that, trying to do product introduction as well. So you have to have the evidence of impact for that. Then one of the things that PACT has always laid emphasis on is actually designing our products or our technologies around the user. Number one, it doesn't make sense having a product designed and it's not used. You can have a vaccine, you can have a device that basically addresses a very critical need. But if the users, and I'm talking users here, both patients or persons, as well as providers, are not able to use them, then you're just going to have another relic on the shelf. And the fourth thing that we have also looked around also is collaboration. PATH is very, very big on partnerships. And that is one of the things that we pride ourselves in, being able to leverage and develop partners across global, both at the global level, at the country level, and even in local communities. And that is very, very key when we're doing product introduction. Product introduction, basically bringing all the stakeholders to the table, providing the evidence, and even just playing the role of a neutral broker to ensuring that this products make it to market. And I'm going to also touch on the regulatory aspect of things here. As we look at—
Dr. Tegbe, before you go into the regulatory aspect, maybe you just want to mention to us some of the groups that you've partnered with across these 4 principles, because it's actually quite interesting, the outcomes of the case study, and who are these partners?
Okay, some of the people that we have partnered with include we partner a lot with the World Health Organization a lot, particularly around how will I put it? The ensuring the quality of the products that we're putting out there, because we need to go through a lot of products that we need to put out there, need to go through regulatory approvals, need to go through WHO standards as well. So we partner with them, we partner and work a lot with them. Then a lot of our funders, a lot of our projects are funded by the Gates Foundation, who are very, very big on innovation and product introduction in markets, and also ensuring that markets are healthy. We also partner a lot with the USAID amongst others. So those would be some of the people that we partner, organizations that we partner with. Then secondly, we also partner with a lot of pharmaceutical companies. We have a program called Access. Sorry, I'm blanking out on the name. Access. Sorry, I'm blanking out on the name. But Pfizer is a part of that organization. I think Merck is also a part of that organization, basically around NCDs, looking at NCDs and ensuring that products and services are make it to market. Yeah.
Thank you very much. And I'll come back to you on the regulatory piece, but what I was just driving out there was, again, the theme of collaboration. Like, not one person actually does it all alone, because it's a theme that I'm seeing recurrent through all the companies that we're talking to here. So very key 4 principles that you shared with us today in terms of making options available, making sure that they are designed for the end user, the research work that you do in ensuring that you can build evidence and provide data on the impact of the work, as well as collaboration. So I think excellent work there as well through PATH. I'm going to zip back now to Azuka of the ARC. And, we've listened to you about, fantastic work that you have done in the academic space, as well as, practically in Nigeria, ensuring that you can educate people, both professionals as well as policymakers, on the impact of the supply chain. Now, can you tell us how private companies can help African countries optimize existing assets as well as people, using the work that you've done with on skill?
Thank you very much. So, and I've just been learning as I listen to everyone, and exciting work we're all doing. One of the things, and one of the main reasons why we actually decided to expand education and research is to get the public sector to begin to see health as a low-hanging fruit for revenue generation. we wanted governments to see the revenue potential of health and begin to invest in health. And then if they are to invest in health, they also have to leverage existing structure and also the expertise in-house. So we wanted them to have a new way of thinking. How do you get government leaders to begin to think strategically of what do I put money into, and then how do I leverage private sector expertise? Beyond private sector expertise, we also wanted them to see how they can begin to tap into the CSR platform of companies for supply chain management. So these were the key drivers of actually the academic pursuit. And like you said, local universities, the work was actually in collaboration, the collaboration between MIT and local universities. When we had started, there was no university providing supply chain postgraduate degrees, but currently we have 3 universities running masters in supply chain education by our direct intervention, but also other schools are beginning to do that in Nigeria. So one of the things, like I mentioned earlier, was also how ready is the private sector? If you do want to collaborate with government, do you understand the ecosystem? Do you understand the partnership opportunities? So we have actually done a lot of work with companies across both, mostly around the pharma space, Novartis, Sanofi, Pfizer, we have been working with them, but also in FMCGs. We have been working with you, Procter & Gamble, like you know, recently Kimberly-Clark, a lot of top private sector companies, but also local companies. One of the things we're trying to do is, if government is ready to invest, are you ready to partner with government? So we have been brokering those collaboratives because we see it as a win-win, both for governmental and also for private sector. We don't want government or the government in Africa to keep seeing health as aid, you know, donor, thinking in that mindset. We want them to know how to invest in supply chain and also for the broader good of the public health industry, but also we want them to create enabling environment for PPPs and also even contract management with the private sector.
Great. Great. Yeah. Thank you. Yeah. Thank you very much. Thank you very much, Azuka. I mean, I know that you've partnered with a number of the companies here, and it's actually music to my ears to see that, you know, we're advancing supply chain education in Nigeria. I think that in itself is a game changer already. I'm going to move over quickly to Julia to tell us what kind of investments African countries should consider in improving the supply chains for expanded availability of vaccines and other medicines and healthcare products. Going by the trend of the conversation today, you know, supply chain expertise is critical to primary healthcare delivery.
So thank you. And Azuka, if we were together and it wasn't a pandemic, I would hug you for saying what you just said about the importance of health for economies, because, you know, the societal value of vaccination has never been more clear. So really, really appreciate everyone who is educating policymakers about the importance of health to the economies and countries. And, you know, as I mentioned in my opening remarks, I think we have a window of opportunity right now when both the upstream and the downstream supply chain issues are front and center to educate not just health officials, but also finance officials about the need to modernize and expand supply chains and to make them more robust. And as you know, many of my fellow panelists have already said, this is going to take a multi-pronged approach to address both the human capital as well as the design and infrastructure challenges. And both financing and know-how are going to be critical going forward. So I'm going to talk a little bit about some of the ways that the expertise that that we have is being brought to bear, as well as, you know, catalytic funding. And one of those is with the International Federation of Pharmaceutical Wholesalers Foundation. MSD is one of several private sector partners that fund their programs, and they also include J&J, GSK, but also organizations like UPS and many other government donors and nonprofit organizations. And this particular initiative, which is a longstanding initiative but is being expanded right now, includes 3 parts. The first component focuses on building the capabilities of supply chain professionals through an executive training program called STEP. And what makes this particularly unique is that it pairs these public sector supply chain managers with private sector supply experts, many from MSD. And the second component also really taps into the expertise that we have as a company and focuses on the supply chain network itself. And it is supporting the research and testing of innovative and sustainable solutions to further optimize and modernize vaccine supply chain networks, many of which were designed in the 1970s or earlier. We supply the time and expertise of our technical experts, and we provide catalytic funding to test new models that could potentially be scaled in and across countries. And then the third component, which is really exciting and is in the planning phase now, will focus on innovating within the supply chain by supporting the introduction of new cutting edge technologies. And we'll support that through the development and scale up of these solutions by providing technical assistance, training, other resources like business modeling and understanding market demands. And I also wanted to just go back to the issue of investing in regulatory capacity, because this is also critically important to understand the investments that need to be made to support regulatory cooperation. And I think a great example of where we learned a lot about this regulatory capacity building is with our Ebola work. It took the willingness and the capacity of multiple regulatory authorities, the WHO and our company, to work together in a very different way than we had worked together before, and to streamline and simplify processes and requirements, and also to work in parallel when we're used to working in sequence. And what had to be in place in order for all of this to work was the enablement of electronic submissions, the existence of interoperable data systems and digitalization. But what we got for that, for all of that work, was that we all worked together on an aligned regulatory strategy focused on obtaining approval in the African countries in highest risk for Ebola outbreaks as the most important area of focus. And what that enabled was the WHO to work with the European Medicines Agency, the Africa Vaccine Regulatory Forum, and our company to develop a collaborative review procedure for licensing and introduction in African countries, which resulted in WHO pre-qualification 36 hours after EMA approval, and several African country approvals within 90 days of that EMA approval. And usually this takes years. So this is a really promising practice. And then one other innovation that we had regulatory agreement on was for a single product label that was in both English and French to support the global stockpiling that was begun, and will mean that there's more rapid distribution in the future. And so just a little bit on that.
Thank you, Julia.
Yes.
Thank you, Julia. There's a lot in there already. I'm even struggling to capture most of it. I think you touched on so many areas, but very importantly is the fact that you're focusing on both developing supply chain capabilities as well as regulatory capabilities. I think the two go hand in hand, because we can definitely scale up the supply chain capabilities if we have the regulatory backup and systems to go with it. And also very critical, and I think it's something that probably many people had to jump into, is the fact that you now had to work everything in parallel. There was no time anymore. There's no time to go one after the other like we'd normally do as scientists, but it's, this and. So excellent intervention by MSD there. And, I'm sure there will be opportunity during the Q&A session to share more of those ideas. At this point, I'll ask everyone online to ensure that they can submit their questions using the chat box for the or the Q&A box that you have online. Quickly going to Patricia. Coca-Cola is pioneering partnerships to strengthen health systems across Africa by leveraging its distribution networks. So can you share with us a little bit about the importance of building resilient health systems and the role of the private sector, just in 2 minutes?
Well, thanks, Ogre, for the question. I think the COVID-19 pandemic has shown us, one thing it's shown us is the importance of having resilient health systems. And it's also shown us how the private sector can be helpful, even just from all I've shared about our work with Project Last Mile. You can see that there's so much that is transferable from private sector to public sector that can help build stronger, more resilient health systems. One thing that the private sector can do for sure is share best practice. The ministries of health can certainly look at best practice from the private sector to streamline and strengthen the supply chains down to the last mile. Most people you would see, and Tokwe from Procter & Gamble, you would know that consumers tend to find our products in quite remote areas. I mean, for my company, the company I work for, Coca-Cola, people can usually get a bottle of Coke nearby, even in the most remote areas. So there is a lot that ministries of health can learn from the way companies like ours operate our supply chain and distribution systems, and use that knowledge to strengthen the delivery of much needed life-saving medicines, vaccines, and health services. Another role that the private sector can play is, again, sharing best practice in strategic marketing. Now, private sector generally survives by marketing products and making people see the benefits of our products or what we have to offer. Many times, the problem with delivering much needed health services comes down to letting people understand the benefits. Like from my experience with Project Last Mile on HIV/AIDS, just creating awareness of the importance of testing came extremely useful in getting people to have access to these health services. And transferring that to the COVID-19 pandemic, creating awareness about the benefits of the vaccine is something that could easily be done by borrowing from marketing strategies from the private sector. So that's another role that the private sector can play.
Thank you very much. You have one last thing, yes?
Yeah, I was going to say that very important is investment in technology. Real-time data-driven insights can be extremely helpful. And if I may give an example on the COVID-19 vaccine, at some point we all realized that ultra cold chain facilities were critical to create equitable distribution of vaccines in Africa. And so when you look at Coca-Cola, for instance, we use, ultra cold chain facilities rely on dry ice. Dry ice is basically made from liquid carbon dioxide, an ingredient that's found in many carbonated drinks and certainly the ones that we produce. So even just understanding that exists in the private sector could be useful for the public sector. So Project Last Mile did a feasibility study across 70 countries to figure out where do we have dry ice. And we found that there was ample supply of dry ice across the globe. And we are talking of finding information from 70 countries in Latin America, in Africa, in the Pacific Islands. Now, without access to that kind of data, it's difficult to move forward. So we found that it was available. We found that there were 23 countries that could produce dry ice, even if it wasn't already available, and could transport to neighboring countries. So this is critical. Public-private partnerships, I think, Tokwe, you've mentioned it several times, is the important thing in building these stronger systems.
Thank you so much, Patricia. I see the audience are also dying to engage. I have a number of questions for you from the audience as well. And you're quite right. There's a lot that the public sector can learn from the private sector and vice versa. But in the area of supply chain, because we move goods, to the last consumer, we have a lot of experience and expertise there, like you have shared. I'm waiting to find a bottle of Coke in the desert, one day. So I'm going to take you up on that at some point. I'm going to move finally to Dr. Muyiwa Tegbe to just share with us. I stopped you just earlier on the regulatory changes that African countries can make to optimize the supply chain. So if you can just share that with us now, our audience are dying to hear from you.
Okay, thank you so much. One of the things that we, and I'm going to piggyback on what Patricia just said, just following up on that and starting from there, is evidence is key. Evidence is really, really key. There's a need for African countries and subnational and national leaders to develop policies or to make changes in supply chain, healthcare delivery systems and things that are based on the evidence. That will lead me to put a couple of pointers out there. PATH does a lot in digital health, digital work, and basically developing data systems, supporting countries and partner with countries and to develop data systems such that the kind of evidence that is needed to actually make informed decisions actually starts from the grassroots. So as we pull that through systems, as we pull that through our data systems to ensure that once a minister of health or a state commissioner or a governor needs to make a decision on what to invest in and what not to invest in, the evidence is at hand. Then I'll go back to partnerships, right? Working with ministries of health, different ministries of health, working with people at the community level, working with a lot of partners at multiple levels to be able to say that, how do we even translate this evidence into action? Then a couple of things that I want to point out there is that regarding the regulatory changes specifically, unfortunately, a lot of our systems in low middle income countries, particularly Africa, are what I call legacy systems. They were built in the 1960s, 1950s, 1970s for the population at that point in time, right? But are they really nimble or are they applicable for 2021? And how do we now ensure that we actually meet the needs of those people, of the populations that we have right now? So a lot of changes need to make, even in the way we actually look at how do we partner with private sector? And I'm not just talking of the large conglomerates of P&G, Coca-Cola, but how do we partner with small and local businesses to be able to churn out these innovative ideas that Azuka mentioned earlier, to be able to create a platform whereby we create an enabling environment for them to be able to thrive and bring in innovation. Secondly, there was mention about financing also. How do we actually create systems such that there's access to finance and there can be changes or there can be improvements in supply chain issues, as it were. There's also a need for actually identifying, being able for government to be able to say that we want to hear what our citizens are saying, right? We want to hear what they're doing. And that also should inform how we actually develop regulations and how do we actually develop programs or how do we actually develop innovations or initiatives to actually meet their needs. The second piece of it also is looking at healthy environments. And I'm actually talking particularly from a primary healthcare perspective. So pardon me for that. How do we create healthy environments? I talked about manufacturing. How do we crowd in more private sector operators to be able to say that Lesotho is a good country for manufacturing? How do we go there? Nigeria is going to be a good country for manufacturing. How do I go there? And how do we make the regulatory environment very, very friendly for them to go in? There are a lot of stories, both good and horrid stories, about regulatory challenges that companies have run into because of that. So I think governments need to start thinking about that. How do we make this environment more healthy or more friendly for private sector to come in. Then suffice to say that there needs to be, basically, like I said earlier, there needs to be a different approach to regulation and rulemaking. And I go back to partnerships, right? How do we see private sector as partners in delivering health? How do I see private sector partner with them in delivering vaccines to the last mile? I want to see a vaccine where Coke has a bottle of Coke, right? So that should be the approach. And I think some of the things we should start thinking about, making those regulatory changes to ensure that if a bottle of Coke can get to the border of Nigeria, close to Chad, then we should be able to make sure that a vaccine can get there as well. So then the fourth piece, sorry to take your time, is just rethinking health system design, right? How do we rethink health system design? And how do we partner with them? Who are the partners that we need to actually ensure that healthcare gets, that a woman on the border on the farthest borders of the country can actually receive a vaccine, a child can receive a vaccine and get the healthcare that they need.
Thank you very much, Muyiwa, for those succinct guidelines and experiences shared where government or regulators can actually help to improve healthcare delivery. And the work that you do at PATH obviously would enable government to take these evidence-based decisions in ensuring that vaccines as well as other healthcare products can actually get to the final user in that last mile, like we've been talking about. Okay, so now I'm going to move over to the audience. We have a lot of questions. I will take as much as I can as we're getting close to the end of the program. I'll start first with a question to Patricia. Kudos to Project Last Mile. What was the status of the institutional capacity when you launched this partnership in South Africa? Was their organizational structures ready for this kind of private sector partnerships? Do you think Africa's healthcare nonprofits have the institutional capacity to support such emerging supply chain partnerships? A deep one.
Okay, well, thanks for the question. It looks like 3 questions in one. Well, first of all, when we started, when Project Last Mile started in 2010, it wasn't fully developed with the different partners, but since from when we started then the first pilot programs, it's developed quite steadily and become what it is today. So it wasn't about the fact that the systems were all in place and ready to go with the partnerships. It was about learning and growing and developing more and more experience. So by the time the pandemic hit, Project Last Mile had already gathered the experience and expertise that could help the group collaborate easier with the non-profits. Now, I can't comment on the, I don't know that I am the right person to comment on the readiness of non-profits in Africa, but I can definitely say that we are open to working with non-profits across to build stronger health systems. And we've provided a fund of $2 million already for Africa, and this is from an entire $20 million for the globe to help stop the spread. So there's a lot of room to collaborate further to strengthen the health systems here. But definitely, we're open to partnering, and it doesn't matter where we are in terms of readiness on the continent. I think we start from where we are, we meet each other where we are, and we work on what's needed and innovate to fill in the gaps that exist today. I hope that answers the question.
I hope so too, but you touched on quite a few points there, and most importantly, the readiness to partner. And I think that theme cuts across all the companies present here today. There's no one person who has it all. Everyone has had to collaborate with experts and different partners from different sectors to achieve, a kind of, move things forward or create a momentum during the current pandemic and then also going forward. So thank you, Patricia. I'm going to direct this question to Azuka. As a question from Umaka Okafor, Director of Pharmacists Council of Nigeria. Well, she says, or he says, I mentioned the need for local curriculum when we try to access foreign trainings. Can a training institute like that of Zaragoza accept to teach content that is outside their own curriculum? It will be good if African countries in particular can identify our knowledge and skills gaps and ensure that the foreign trainings we secure are able to solve our local problems. Azuka, do you want to address this question? I think there's a combination of some of the learnings that you've shared as well as some of the learnings that Dr. Tegbe has shared.
Thank you very much. Very succinct, because the program, the collaboration with MIT Zaragoza is that they take on students that are within the public health sector, students with that institutional memory that are looking at research. So it's more for the master's degree program where they are going to work on research within the states in Nigeria. So they, and that's how Zaragoza is looking at it as a development collaboration. They do not want to bring in just the learnings from the global community. They want the governments to really apply global best practices to the research that speak to the problems on ground. So that's the collaboration. And also for the local universities that are running their master's program, they are also taking those programs, the MIT programs, because we also want faculty that have access to global best practices, so that when you go to a university, for instance, in UNN or Nnamdi Azikiwe University to do your master's in supply chain management program, you are being trained by faculty that have been trained by MIT. So for us is that we bring out expanded access to talents that have access to top grade education and research.
Thank you. Thank you very much, Azuka. I think this is really pertinent to ensure that the programs or the curriculums that we develop bring in the best of the Western world, but also takes into account our own local situation and capacity as well. Dr. Tegbe, I don't know if you want to contribute to this topic as well, seeing that you gather a lot of data and you've been very bullish on evidence-based decision making. So how do we fare on this one?
Thank you so much. And I think there's a lot of realization that global learnings without a cultural or local context, without local context, the appropriate local context doesn't work. A lot of organizations, a lot of funders, a lot of players in the field right now, particularly in healthcare, need to have gotten to that point where there is an understanding that for us to be successful in turning the tide of global health challenges, we need to understand and listen to the people on the ground. And that is why approaches like human-centered designs and getting patient feedback is really, really key, really, really important to any organization or any initiative that is going to succeed in turning the tide. And also in supply chain, just honing it down to what we're talking about right now, the challenges in Malawi are totally different from the challenges in Lesotho, are totally different from the challenges in Sudan and South. So there is an understanding there is a need for that. And the evidence needs to be generated from the ground as much as possible. So that even country leaders or subnational level leaders can make those informed decisions. And basically, as I said, also using data tools, because that is the basic way there's a lot of interest in that right now. There's a lot of realization that we can actually use data to actually change things. A mentor of mine always says that wherever there's a cell phone, you can actually get any information that you can get. So, and we see there's a lot of deep penetration of mobile technology across the continent. I think that we can also use that to actually get the information that we need to actually change or to redesign health systems, as it were.
Thank you very much, Dr. Tegbe. I have one last question, which I will direct to Julia. And it goes, what is being done about encouraging CSOs like ours who work already in the area of research and work with tertiary institutions? For example, LWI. And LWI is a company called Live Well Initiative. It's a self-sustaining nonprofit healthcare organization which has impacted almost 2 million Nigerian patients. So, but back to the question. So for example, LWI works with Harvard School of Public Works, helping to train candidates in field research. Are private companies willing to work with CSOs to scale up this good work? Julia?
Yeah, thanks for the question. And you know, as my fellow panelists were talking, the thing that just kept in my mind was understanding the capabilities and the limitations of organizations is critically important in all of this. So what is the academic partner most well-equipped and leveraged to do? What is you know, a private sector, highly regulated, but with a lot of expertise company like mine able to do? What is an organization like PATH or a community CSO ultimately going to be able to do to address this issue in the entire value chain? And I think the important thing is just to understand that partnership needs to take place, and that partners need to be very, very clear about what they bring to the table and what they can't bring to the table. You know, I worked for the US government for 15 years before I came to industry, and you know, in a regulatory capacity, and I was surprised by what some of the limitations are and what we can do directly with governments, as an example. So, you know, we need to partner with organizations like Gavi or its alliance partners or other, you know, non-governmental organizations, typically in order to be able to bring our expertise and our capabilities to bear on the challenges of governments. So I would say absolutely, you know, we are willing to work with any and all sectors on trying to deliver solutions to the challenges that we have. And I think it's just about all of the right partners getting around the table and talking about what they can bring forward. And, you know, to the also important points that have been made, start with identification of the problem where the problem is happening, so that we're solving the problem that exists, not the problem that we believe may exist going into those conversations.
Thank you very much, Julia. And there you have it, a very, very rich conversation this afternoon. It is very, very clear that, you know, supply chain development and education is critical to access to vaccines or even healthcare delivery across various spheres. It is also central to economic development as well as skill. There are various opportunities for learning across the public and private sectors, and lots of examples have been shared today where a lot of the achievements that we've had in the last 18 months would not have been possible without partnerships and collaborations within the private sector and also with the public sector. The regulatory frameworks are also important in advancing healthcare, as well as promoting the right practices in the supply chain in different countries, and particularly in Africa. So I really hope that, you know, we've gathered a lot here. There's a lot of requests online for partnerships with, you know, smaller companies. And I think that, you know, as we evolve in our new normal, or the normalcy that we're going to evolve into, many of these opportunities will continue to expand. There are various micro expertise amongst the smaller companies that they can bring to bear and support companies like ourselves. We are all here always looking for people to partner with. You know, just bring on that right idea. And I assure you, a number of the companies here are willing to partner. So I'm going to close here. I want to say a very big thank you to my esteemed group of panelists here who have done excellent justice to the topic today. and to the Corporate Council on Africa for the timely intervention and introducing this topic at this point in time. Lots of learnings that we're going to go away with. And now I'm going to hand back over to the CEO of the Corporate Council on Africa, Flory Lizzie. Thank you.
Well, thank you, Tope, and many thanks to our esteemed panelists. What a great discussion. This was so insightful. You kind of hate that it's a pandemic that gets us to innovate and think about ways that the private sector can contribute to that last mile distribution of products, and in this case, healthcare products, pandemic related products. Thank you also to our audience for being so engaging with the questions that you sent in. As you know, I'm Flory Lazier, Corporate Council on Africa President, and I hope that all of you found this dialogue informative and as thought-provoking as I did. The initiatives and programs highlighted in today's discussion are really great examples of the innovation that can come out of partnerships and leveraging the strengths of the private sector to address health supply chain challenges for improved service delivery on the continent of Africa. CCA will continue to use our U.S.-Africa Health Security and Resilience Initiative as a platform to engage and support our members and stakeholders and our U.S. and African public and private sector partners as we all work to develop new solutions and strengthen health systems in the new COVID-19 era. On behalf of CCA, thanks again to our esteemed speakers and to the audience for your participation. Stay safe and have a good rest of your day or evening. Thank you.